Well, thank you for the invitation to join you here today. I just want to give a quick shout out early on to my team in the PEP lab at UNC, and also to the various agencies of NIH that have funded my past and current work. We all know positive health behaviors are good for us. Certainly staying physically active, eating fruits and vegetables, and I add meditation here because some of my research has used that as a positive health behavior as well. The big question is how to stick with these behaviors. We know that they're good for us. We start new habits and then we lose them. We know this is part of the problem is that willpower fails. Willpower is great at behavioral initiation. Willpower is not so great at behavioral maintenance over the long term. And what studies show is that for behavioral maintenance, what's much more influential is non-conscious processes and certainly habits, but sort of a question of how those develop. Well, we also know that enjoyment motivates, and what the research I want to share with you and the theoretical framework behind it is really trying to unpack why does enjoyment motivate. I don't think this mule is thinking about, in a conscious, deliberate way, the benefits of carrots, but he's drawn in that direction, he or she. So what we know about enjoyment in positive health behaviors, and this includes both physical activity and meditation here, is that positive affect from those positive health behavior forecasts behavioral engagement even at 15-month follow-up, and especially for positive affect during those positive health behaviors. We know things like exercise boost positive affect for hours after a bout of exercise. That positive affect doesn't seem to be as influential as the positive affect people feel during the activity. And so what I want to share with you is a model that my team and I have developed to try to understand some of our early effects about how influential the early positive affect to beginning a meditation practice predicted whether people stuck with it 15 months later. In an effort to understand that phenomenon, we've developed this upward spiral theory of lifestyle change, and it's rooted both in neuroscience and in my broaden and build theory of positive emotions. I'm going to give you the quickest presentation of the broaden and build theory, and this is the idea that subtle, mild positive affect broadens our awareness in subtle ways, but expands our awareness. And the more those moments of positivity and expanded awareness accumulate and compound, the more they build our resources, like our mental health, our social integration, our physical health, in ways that are akin to the way nutrients, fruit and vegetable consumption is something that we need to have a daily diet of in order to improve our physical health months later. Our daily diet of subtle positive emotions each day contributes to the building of enduring resources like mental health and physical health. From the neuroscience literature, I've drawn on two distinct but related literatures, one on addiction and the other on sickness behavior. From the neuroscience of addiction, I'm very influenced by Kent Berridge's work on that disassembles reward processes into separate liking and wanting systems, with the idea that dopamine is particularly relevant to the wanting or incentive salient side that draws us towards things, but not so much to the enjoyment side. And then I'm also influenced by Naomi Eisenberger's work on how that comes into under the heading of the literature on sickness behavior. And this is that inflammation alone has its own psychology, so that when you inject an endotoxin in randomized trials, people report feeling like they have less energy, they're a little down, they don't want to be with people, they don't want to be physically active. This isn't about sickness per se, but the inflammation. And also that this same endotoxin challenge has been shown to reduce the activity and reward areas of the brain that are, critically linked to dopaminergic function. So it's like inflammation is turning down the dial on positive affect experience and kind of muting the system. And so from that, I was thinking, well, we have a collection of sickness behaviors, not wanting to be with people, not wanting to be physically active, and so on. Maybe we also have a coherent set of wellness behaviors, things like being physically active, being social, learning something new, pursuing meaningful pursuits, eating well, and caring for the body. What these have in common is that they, unlike sickness behaviors are about surviving the day, and perhaps also not infecting others. But wellness behaviors are about investing in your future. And these are not things you do if you think you're not going to live the week or get through this illness. But you're taking a proactive investment in the future. And the insight or the principle of the upward spiral theory is that one basic principle is that biological and psychological resources, what I'm calling vantage resources, after the Plus and Belsky work, certain biological and psychological vantage resources can amplify or turn up the volume on the positive emotion system, which can make these wellness behaviors more appealing because they're more affectively rewarding. So this upward spiral theory of lifestyle change has one overarching hypothesis, and I'll give you that before I give you the diagram of it, and that is that positive emotions create non-conscious and increasing motives for various wellness behaviors. And just to give you a diagram of it, it's a spiral model, but it has two layers. There's an inner loops of the spiral and an outer loop. And the inner loop is inspired by Kent Berridge's work that distinguishes between liking and wanting, and then situates a concept that in his work he calls incentive salience. And here I'm just simplifying that a bit and calling it non-conscious motives. But that to the extent that health behaviors, positive health behaviors, increase people's positive emotions, and I just want to be super clear that I do not think all positive health behaviors increase positive emotions. Sometimes we just do it. We willpower our way into this. But to the extent that these wellness behaviors do elicit positive affect during those interactions, or during those behaviors, then these other processes come into play. Okay? So one of the key downstream effects of positive affect experience during health behaviors is that non-conscious motives for those behaviors begin to develop. People begin to have this non-conscious incentive salience for that activity, and having more of that non-conscious motivation sets up people to be more likely to engage in that behavior again and experience positive affect in that behavior again, and so on. So this is the inner loop of the upward spiral model. On the outer loop side is sort of the broaden and build loop of the theory. And that is that as positive emotions increase people's positive affect over time, that incrementally that serves to build resources. And some of those resources function as vantage resources that leverage the positive affect that you gain out of a given wellness behavior. And I'll give you some examples of this. And the little kind of speaker volume sign is my little image for amplification. So this is a way that vantage resources moderate how fast this inner spiral develops. So I just want to give a quick shout out to Dr. Patty Van Capellen, who's been a close collaborator of mine as I've developed tests of this model over the last few years. And the inner loop I'm going to give you two examples that come out of my research lab to illustrate the inner loop and the outer loop. There's more research than I can fit into this talk, but I wanted to illustrate this here. And here I'm focusing on positive spontaneous thoughts and as a marker of these non-conscious motives for wellness behaviors. And I want to give a shout out here to Dr. Elise Rice, who is now a postdoc at NCI. And the studies that I'm going to share with you next were all from her dissertation that she completed last year. So thank you, Elise. If you have questions about this work later, you can ask me or Elise, and she'll be here longer. I want to give you an example of what I mean by positive spontaneous thoughts. One way that we've measured this, we've measured it in multiple ways, but sometimes we simply ask people, how often do thoughts about physical activity seem to pop into your head or just come to you? So we measured the frequency of these spontaneous thoughts that just pop to mind. And then we ask a second question. Considering these thoughts, what percentage of those thoughts are positive or pleasant? We also ask what percentage are negative, but all the action is with the positive here. These are the positive counterpart to intrusive thoughts that really have gone very much understudied. We really have focused on the intrusive thoughts or uncontrollable negative thoughts, but nobody's really looked at until Elise, this positive side. And what we know from initial research is that these positive spontaneous thoughts function just like incentive salience in that they bridge the gap between or mediate the effects of liking, enjoying a wellness behavior and enjoying an activity, and the desire to do that again in the future. So this was a study where we had 103 participants responding to survey questions about 10 different activities. They told us how much they have liked that activity in the past, how much they wanted to engage in it next week, and then also how many positive spontaneous thoughts they had about it yesterday. So we tried to get some temporal separation here, even though it's a survey study, and we find that there is significant mediation by positive spontaneous thoughts. Now, that helps us position positive spontaneous thoughts here as a mediator between liking, the top box of the inner circle, and wanting, or the behavioral index of wanting, engagement in that health behavior. And we also have a longitudinal study that links these concepts together with daily reports, a daily diary study where we measure how much positive affect how much did you engage in physical activity today? How much did that elicit positive affect? That's our measure of liking physical activity. As a separate measure on a different day, we ask how many thoughts about physical activity spontaneously come to mind. And then in future days, we measure subsequent behavioral engagement. And we find this mediation for physical activity as well. But in addition to these correlational and longitudinal analyses, Elise sought to get a causal handle on these two separate links. Can we say that positive affect causes positive spontaneous thoughts, and that positive spontaneous thoughts cause behavioral motives? And so that's where these two laboratory experiments of Elise's dissertation come in, and these are being revised for emotion. We had almost 100 undergraduate students. Here we're getting out of the context of health behavior just for a moment, but they were randomized to experience cartoons that were either all funny or a mixture of funny and decidedly unfunny. And then we later asked, while they were doing another task, how often did thoughts of these cartoons spontaneously come to mind, and what percentage of those were positive. And we find that liking the cartoons, which we randomly assigned, creates positive spontaneous thoughts subsequently about those cartoons. So there is a causal path between liking and these spontaneous thoughts. And in the next experiment, Elise sought to manipulate positive spontaneous thoughts. Now, it's a little difficult to do that because these are spontaneous thoughts. And so she had the great idea to manipulate people's perception of the positivity of their spontaneous thoughts. And here we had 80 undergraduate students come into the laboratory, and we randomized them to receive bogus feedback about their spontaneous thoughts about a physical activity, a particular physical activity like dancing or running or hiking that was selected specifically based on their preferences to be somewhat, not quite their favorite, but sort of near their top half of their favorites. And we told them that their thought pattern suggested particular positivity in their spontaneous thoughts. So the way we convinced them of this is we were also measuring heart rate activity, facial EMG. We had all kinds of active physiological sensors on them. And then after that, we showed them this figure. Half the people, by random assignment, received a graph like this that says your data suggests that your spontaneous thoughts about this particular physical activity are generally quite positive, averaging about 88%. And then a little note at the bottom says this only pertains to spontaneous thoughts. We don't have the science to be able to say your deliberate thoughts. So, of course, this is bogus feedback, but what we found was that having the perception that your spontaneous thoughts are positive influences the people's behavioral intentions to engage in that particular activity over the coming week. And here we measured people's intention to engage in that activity in the number of hours they devoted to it in a calendar for the next week. So people are devoting a little more than 2 hours to that activity if they thought their spontaneous thoughts were more positive, which was significantly higher than the no feedback condition. So this upward spiral theory of lifestyle change, these studies of spontaneous thoughts help us test this inner loop, and that is the place where enjoying an activity, like enjoying physical activity, leads to more spontaneous thoughts that are positive about that activity, and that drives people's future engagement in that activity. Now, I want to turn to this outer loop of the spiral now, where we're looking at how vantage resources can leverage this phenomena. And among the vantage resources that we've looked at biological resources. In particular, we have data on heart rate variability as an index of cardiac vagal control. And what we found with this work is that the positive affect people gain from a wellness behavior, here, meditation, is increased for people who have higher levels of heart rate, high-frequency heart rate variability. They tend to experience more positive emotions in response to the same minutes of meditation compared to people with lower heart rate variability. And more time spent meditating leads to increases in, or more enjoyment, more positive affect from meditation produces increases in cardiac vagal tone or high-frequency heart rate variability over time. So we see this upward spiral between enjoyment and the activity. So just to go back to this figure for a second, what we're finding here is that the biological resource moderates the positive affect yield of the behavior, and that also the positive affect accounts for increases in that behavior over time. Okay. So heart rate variability has been one. I just put a little splash of oxytocin here to remind me to tell you that we have preliminary evidence that oxytocin functions in the same way as a vantage resource, but I don't have time to talk to you about that at this time, but you can ask questions about it. The psychological vantage resource we've been looking at is prioritizing positivity. This is a new individual difference measure that Lana Catalino has particularly spearheaded. This is Lana Catalino, formerly from my laboratory. This work is some of this work was inspired by her dissertation, and she's off to Scripps College shortly. And prioritizing positivity, you can think of this as, when you select your to-do list for the day, to what extent do you include things that are going to feel good? Sometimes we just put all the have-tos on our list and we don't have anything that feels good. Prioritizing positivity, people who score high on this measure are more likely to think about what they do outside of work in terms of how much positive affect it yields. And we find that this individual difference also increases the likelihood of gaining positive affect from meditation, and gaining more positive affect from meditation increases prioritizing positivity. And we have also done a field experiment where we randomize people to increase their prioritizing positivity by having them read a short article that we say is from Scientific American Mind that basically very quickly outlines some ineffective strategies for increasing positive affect, just trying to wish yourself to feel good, versus effective strategies, planning your day to increase more positive affect. Okay, I'm going to speed through these. That intervention increases the positive affect people feel during meditation. Our hypothesis, and we have a grant under review now, is that getting people to prioritize positivity in physical activity will create these non-conscious and increasing motives for physical activity. So again, I hope that these examples have helped you see how this inner loop and outer loop work together, and I just want to thank you for your attention.